Now, for the first sign of hypertensive complication of preeclampsia, we need to know that what the first complication was the stroke. When you have a stroke, the patient is going to have a sudden onset. If you have a stroke, the patient is going to have a sudden onset hemiplegia. If you have subarachnoid hemorrhage, the patient is going to be characterized by the thunderclap headache. If you have hypertensive encephalopathy, it's also going to have headache and signs of raised intracranial pressure. Provided there is a shift of the midline, you may have also a focal neurology deficit. Is it clear? If the patient has an ischemic heart disease, is it clear? The patient is going to have a constrictive chest pain and ischemic chest pain. Is it clear? Chest pain that is squeezing in character. If you have a acute left ventricular failure, it's going to present with pulmonary edema. The patient is going to be in respiratory distress, and on auscultation, you're going to see here much crackles. If the patient has acute kidney injury, the patient is going to have oliguria, and the patient may have complications of the oliguria, which is in the case of complication like a uremic syndrome. Is it clear? You can have a uremic syndrome, you can have a pulmonary edema, which is another complication, you can have hyperkalemia. Those are the different areas, even acidosis. Is it clear? So those are the different complications there and the presentation that you can have in this patient. Now, the next case is going to be, the next pathophysiology of the complication is going to be an increased proteinuria. Is it clear? Now, when you have an increased proteinuria, as a result to the signs and symptoms of that increased proteinuria is going to be, the first sign and symptom of increased proteinuria is going to be the edema of the patient. Is it clear? When you have generally pregnancy is associated with a grade 1 pedal edema, because the more the uterus is going to be enlarged, it's going to result to an increased pressure of inferior vena cava, which is going to result to a reduction in venous return. That is going to result to accumulation of the venous blood, which is going to result to a pedal edema. Generally, the pedal edema in pregnancy is a grade 1 edema. But now, when you have a grade 2, grade 3, and a grade 4 pedal edema, it means that there's a problem of proteinuria. Is it clear? And that problem of proteinuria is going to result to edema. Now, the edema is not just pedal edema. Now, let me explain this mechanism actually further. Is it clear? You need to know that we have different body fluid compartments. There are different body fluid compartments of a patient. Is it clear? There are different body fluid compartments. Now, you need to know that the first body fluid compartment is the intracellular fluid. Is it clear? Now, directly after the intracellular fluid, we have the interstitial space, interstitial fluid. Is it clear? You have the intracellular fluid and the interstitial fluid. After interstitial fluid, now you have the blood vessels. The blood vessels. So those are the three major compartments that we have. Now, let's take each of them and then we visualize the major ions and the major osmolar products which are located. In the intracellular fluid, the osmolar products are the potassium ion and the proteins. Is it clear? The proteins and the potassium ion are the one that maintain fluid in this compartment. So sodium, the proteins and the potassium ion are the two major ones that maintain fluid in this compartment. Now, in the interstitial space, the sodium ion that maintain fluid and the chloride ion are the two major ions that maintain fluid in the interstitial space. Now, in the blood vessels, even here, in the blood vessels, you have sodium ion which maintain the fluid in the blood vessel space. You have the chloride ion, and you have also the proteins, the globin. Is it clear? The globins of blood, like albumin particularly. Is it clear? Now, those are the three major ions. What happens is that in preeclampsia you're going to have a loss of the globins. Is it clear? When you have loss of globins, it makes that this osmolar space of the blood vessels is going to reduce. So the osmolarity of the blood vessels is going to reduce. So the fluid that is supposed to be normal in the blood vessel is going to shift to enter both the intracellular fluid compartment and the interstitial fluid compartment. It's going to shift and enter in both of them. So you're going to have an edema both of the intracellular fluid edema, and you have also an interstitial fluid edema. Is it clear? So those are the two edemas you have. The interstitial fluid edema is going to be presenting as the pedal edema. Interstitial fluid edema can present as pedal edema. It can also present as pulmonary edema. Is it pulmonary edema, pedal edema? That's how the interstitial fluid edema presents. But now the intracellular fluid edema generally is going to be produced as cerebral edema. Is it clear? So if the patient just have proteinuria without an increase in blood pressure, the patient is going to have cerebral edema, and cerebral edema can also complicate to a raised intracranial pressure. Is it clear? And that raised intracranial pressure, you have signs of raised intracranial pressure, which are headache, which is blood vision. Is it clear? So those are the different signs of raised intracranial pressure the patient is having. Now for pedal edema, you have the signs. There is also signs of pulmonary edema. Signs of pulmonary edema is going to be frothy or foamy cough, or foamy cough with frothy and foamy sputum. Is it clear? Which can be tinged with blood, sometimes hemoptysis. Is it clear? And then you have other signs. You have respiratory distress, you have neural association dyspnea. So you're going to have dyspnea in this patient with orthopnea, and paroxysmal nocturnal dyspnea. So those are the different elements that you can have in a case where you have a patient that has a loss of body fluid, this body fluid compartment as a result of the proteinuria. Basically, so those are the symptoms that you are going to have as a result of proteinuria. Now, the next pathophysiology is going to be based on obstetrics. So the complications of the obstetric complication of the obstetric complication of preeclampsia is going to be seen in the next video.